Hook curious. If GLP-1 weight loss shots like Ozempic, Wegovy, or Mounjaro can actually help you lose weight safely without turning your life upside down, in this video you'll learn what these medicines are, how they work, who they're for, real-world benefits and side effects, what to eat while using them, and how to avoid regain if you ever stop. Stay to the end for a practical starter plan you can begin this week. Keywords to listen for: GLP-1, Ozempic, Wegovy, Mounjaro, Tirzepatide, Semaglutide, weight loss, appetite, A1C. Plain English overview: GLP-1 medicines are a family of drugs that help with blood sugar and appetite control. Wegovy, Semaglutide, is approved for chronic weight management. Ozempic, Semaglutide, is approved for type 2 diabetes but often discussed for weight loss. Mounjaro, Tirzepatide, is approved for type 2 diabetes. Its weight loss brand is Zepbound, same active ingredient. These medicines are usually given once weekly as tiny injections using a pen device. Think of them as a medical assist that helps you feel satisfied with less food while you build better habits. How they work in your body: GLP-1 hormones are naturally released in your gut after meals. They send "I'm getting full" signals to your brain, slow stomach emptying so glucose rises more smoothly, and reduce liver sugar output. Semaglutide mimics GLP-1. Tirzepatide acts on GLP-1 and GEP, another gut hormone linked to insulin and satiety. Result: lower appetite, smaller portions, fewer cravings, steadier blood sugar, and over time, weight loss. What kind of results to expect? Clinical trials show meaningful, often double-digit percentage weight loss when medicines are paired with healthy routines. Many people also see improvements in A1C, fasting glucose, triglycerides, blood pressure, fatty liver markers, joint pain, sleep apnea, and energy. Results vary. Your baseline weight, dose, consistency, and lifestyle all matter. The goal isn't perfection. It's steady progress and metabolic health. Who these medicines are for. These drugs are typically considered for adults living with obesity or overweight with weight-related health conditions, or for adults with type 2 diabetes who need better glucose control and would benefit from weight loss. They aren't for everyone. They're not approved for type 1 diabetes. They should be avoided if you have certain thyroid tumor risks, personal or family history of medullary thyroid carcinoma or MEN2, a history of pancreatitis that your clinician feels is related, severe gastroparesis, or if you're pregnant or trying to conceive. Always review your history and medications with your clinician first. Dosing and titration. Simply, most people start at a very low weekly dose and increase gradually every few weeks. Going slow helps your body adapt and reduces stomach side effects. If nausea pops up, holding the dose for longer or stepping back briefly is common. The best dose is the lowest dose that keeps appetite comfortable and weight and glucose trending in the right direction. Common side effects and how to ease them. Nausea, fullness, burping, reflux, constipation or loose stools, and early satiety are the most common. Tenderness at the injection spot can happen. These usually improve as your body adapts and you learn your new full signal. Helpful tips: eat smaller meals, chew well, stop at the first sign of comfortable fullness, prioritize protein and fiber, sip fluids between meals rather than chugging with meals, and consider a gentle fiber supplement or magnesium if constipation shows up, only with clinician guidance. Less common but important safety notes. Call your clinician promptly for severe or persistent abdominal pain, especially with vomiting, signs of dehydration, or yellowing eyes or skin. Discuss gallbladder disease risk, pancreatitis history, kidney function, and any previous severe GI conditions before starting. If you take insulin or medicines that can cause low blood sugar, ask about dose adjustments to avoid hypoglycemia as your eating pattern changes. What to eat while on a GLP-1. You don't need a complicated diet. You need a steady pattern your body can follow. Build most meals using a simple plate method. Half non-starchy vegetables for fiber and fullness. A palm-sized portion of protein like fish, chicken, eggs, tofu, Greek yogurt, or beans. A quarter plate of slower digesting carbs like quinoa, brown rice, lentils, or small potatoes with the skin, and a thumb of healthy fat such as olive oil, avocado, nuts, or seeds. Eat vegetables first, protein next, and carbs last to smooth glucose and reduce queasiness. Sample day that works with your shot. Breakfast ideas include veggie omelet with avocado, Greek yogurt with chia, walnuts, and berries, or tofu scramble with spinach and salsa. Midday meals could be a big salad with grilled chicken or tofu, olive oil and vinegar, and a side of quinoa or beans. Snacks can be apple and peanut butter, carrots and hummus, edamame, or a few nuts and berries. Dinner might be salmon and roasted vegetables with a small side of barley or lentils. A relaxed 10-minute walk after meals helps your gut and glucose and may ease mild nausea. Hydration, protein, and muscle protection. Higher protein, high-fiber meals keep you satisfied and protect muscle while you lose fat. Aim to include protein at each meal and snack. Sip water steadily through the day and add a pinch of electrolyte mix if you're especially active or prone to dizziness. Preserve muscle with 2 short strength sessions per week. Chair squats, wall push-ups, resistance band rows. More muscle supports metabolism and makes long-term weight maintenance easier. What about plateaus? Weight loss often happens in steps, not a straight line. Plateaus are normal as your body resets. If progress stalls, tighten your structure gently. Add a serving of non-starchy vegetables. Swap refined snacks for protein and fiber options. Shorten your eating window in the evening, or add a 10-minute walk after the meal you usually skip. Sometimes your dose or timing needs a small adjustment. Talk with your clinician before changing anything. Cost, coverage, and access coverage varies by country and plan. Some policies cover only diabetes indications, some cover chronic weight management, and some require prior authorization or step therapy. Ask about savings programs, formularies, or lower-cost alternatives on your plan. Be cautious with compounded products and online sellers. Quality and dosing can be unreliable. Use only regulated sources recommended by your clinician or pharmacist. Myths versus reality. It's not cheating. Obesity is a complex chronic medical condition with biology that fights weight loss. Medicines can level the playing field while you build sustainable habits. You still need nutritious meals, movement, sleep, and stress care. These drugs make those choices easier to live with. They don't replace insulin for people who need insulin, and they aren't approved for type 1 diabetes. They're not a quick fix, but they can be a powerful long-term tool. Stopping or taking a break. If you stop suddenly without a plan, appetite usually returns and some weight may come back. To protect your progress, anchor the habits that got you results. Protein and fiber meals, smaller portions, veggie-first eating order, short post-meal walks, and strength work. Some people taper under medical guidance. Others switch to a lower maintenance dose. Plan ahead with your clinician so you're not surprised. Fertility, pregnancy, and special considerations. These medications are not recommended during pregnancy or while trying to conceive. Discuss family planning timelines before you start and ask about how long to be off medication prior to trying. If you have significant reflux, gallbladder issues, eating disorders, or severe GI conditions, a different approach may be safer. Bring these up early in your consult. A simple starter plan for this week: choose one grocery list that fits the plate method, schedule 2 short strength sessions, drink water with each meal, and take a relaxed 10-minute walk after the meals that are easiest to pair with movement. Track how full you feel at meals, how your clothes fit, your energy, and your sleep. If you monitor glucose or A1C, watch trends rather than single numbers. When to talk to your clinician, reach out. If side effects limit eating or hydration, if you're unsure about dose timing, if you're seeing lows on glucose-lowering medications, or if your goals include pregnancy in the near future. Ask about lab follow-up, nutrition referrals, and whether your plan should include a maintenance phase once you reach a comfortable weight. Final takeaway: GLP-1 and GLP-1 medicines can reduce appetite, smooth blood sugar, and help you lose meaningful weight, especially when paired with high-fiber, protein-forward meals, steady hydration, short walks, and simple strength work. Think long game. Build habits you can keep, use medicine to support those habits, and review progress regularly so adjustments are small and sustainable. Call to action. If this helped, like the video, subscribe and turn on the bell for weekly, easy-to-follow health guides. Share your biggest question about GLP-1s in the comments and the habit you'll start this week.